Heart disease is still the nation's #1 killer, and doctors are using another high-tech tool to cut the potential for complications.
I got like a pain in my arm or something, and I walked to my desk and went, that was it.
Randy Abshire will soon celebrate his 67th birthday, but for a moment it appeared the Centerville man was not going to make it.
That the heart just started defibrillating, or what they call it, and just got itself so far out of rhythm it quit working.
Sadly, 90% of the 300,000 people who suffer cardiac arrest each year die. And Abshire would certainly have been one of them, but doctors at Good Samaritan Hospital in Dayton used a hypothermia machine that cooled Abshire's blood vessels to cut the risk of brain damage.
So we can actually place these pads on and begin cooling immediately, rather than waiting for somebody to place an invasive line into one of the vessels.
Others may survive, but many develop brain injuries because of the lack of oxygen from the cardiac arrest.
When the body doesn't receive oxygen, there's this chemical cascade that goes on, and when we do get a rhythm back, that chemical cascade takes off. What cooling allows us to do is slow that down, slow the metabolic process down, and that way patients don't develop the brain injury.
And they started lowering my temperature. I don't know, 8 or 10 degrees, or not a lot, I don't believe. But it actually put me into a coma, which slowed everything down, which what I understand reduces damage. The big guy decided he didn't want me. He's got something else in mind for me.
And you're going to do it, whatever it is, right?
If you'll tell me, just don't smack me again. Just, put a sign out in the middle of the street, do something, and I'll do it.
Happy birthday, Mr. Abshire, by the way, who is scheduled for a pacemaker which will help regulate his heartbeat.